Yes, hello everybody. I'm Dr. Margaret Makanyengo, a consultant psychiatrist here at Oasis Mental Health Limited. That's on Peponi Road, Westlands. I'm happy to have the opportunity to just talk something about depression and suicide. As we all know, depression is one of the commonest mental illnesses, not just in Kenya or Africa, but worldwide. And it is a medical condition that is marked by persistent symptoms of feeling sad most of the time. You find you're just feeling low, feeling sad, losing interest in things that you normally like. If you like football, you like dancing, you like music, you find you lost interest. Also, irritability, poor sleep, poor appetite, and being socially withdrawn. So you find if you're the kind of person who used to talk to people and engage in going out, you find you lock yourself in the room most of the time. You don't want to be with people. And even being guilty, feeling guilty when there's no particular thing that you did to anybody. So these are some of the common symptoms you find in depression. And what are the causes? What are some of the common causes of depression? One, it could be genetic. You find in your family tree, in my experience, I find you find in the family tree, maybe the father or the grandfather or the mother or aunties or uncles had depression. So that is one of the common causes. They had depression in their lifetime. So you find some of the siblings, not all, you might find one or two, or sometimes even three, develop depression. So there's the genetic factor, meaning you're inheriting it through DNA. Another factor could be medical illness. There are some common medical illnesses that patients tend to get depression. They trigger depression. For example, patients with diabetes, patients with kidney disease, patients with HIV or chronic illnesses or cancer and others, especially patients who have not been psychologically prepared on how to handle or cope with their sicknesses, they can also end up having depression. Then the other factors is psychological trauma. Uh, Psychological stress and trauma is extremely common, and people experience these things almost every day, but you find the trauma sometimes is too much. Examples of psychological trauma is in situations where you've gone through oppression at the workplace or oppression or stress at home. Maybe you find there's gender-based violence. You have a partner, a spouse who is constantly insulting you, constantly abusing you, physically beating you up, and constant stress. And it could be not just between spouses, it could be parents on their children. And that can also trigger psychological trauma such that the children or the parents or the adults end up with depression. Yeah. And especially if you have nowhere to go, nowhere to get help, you find you end up internalizing all this trauma and you end up getting depression. Then other forms, common forms of psychological trauma is like during war situations, violent situations, social media. A lot of our people, especially the young people, watch movies and programs along on the social media. And some of these programs, some of these movies, some of these sites are very, very traumatizing. And yet you find somebody is watching a site and they just can't stop. And that's the bizarre thing about some of these sites. But they don't realize just what damage that site is doing to your mind. So that is one of the things. The other thing is the pressure in social media where young people want to admire certain personalities, models in social media that make them feel their own body image is low, is poor, that they're inadequate, they're not beautiful enough, they're not handsome enough. So they aspire to be like what they see in the social media. And a lot of young people strive to be what they are not. And that kind of pressure can sometimes make them have a low self-esteem and end up getting depression um, due to that low self-image. So we've talked about psychological trauma. There are just many. This just that there's a short time for us to be able to discuss some of these things. Then, as well as other environmental factors, when you have disasters like we had the Dusit disaster, the bomb blasts, Sometimes when you have violence in mass situations during elections and all these things, a lot of people get traumatized. A lot of people can are prone to getting depression, loss of job, loss of house, loss of family, any loss, any major loss, you end up getting a loss and grief, and you can actually proceed to get depression. So, looking at the causes, we also want to look at how do we handle them? How do we treat depression? Uh, Depression is one thing that one we have to identify it, we have to be able to diagnose it. So I think members of the public need to know the early signs we already mentioned earlier, so that they know that this person needs help. So once you've diagnosed, then come in for treatment. We do counseling with psychotherapy, and that's talk therapy. And in some cases where depression is severe, we have to give medication. Now, some people are suspicious of medication, but you find you don't have to. The kind of medication we use for depression is very safe, and it actually corrects the imbalanced neurotransmitters. But in depression, what happens in the brain is that the serotonin levels go down, and when the serotonin levels, which is a neurotransmitter in the brain, when they are down, you find you're persistently low, suicidal, and feeling sad. So we have good medication which you can take within 1 or 2 weeks or 3 weeks. You find the mood lifts up, and your serotonin levels are normal, and you're able to function. You're able to actually get up, wake up, have your breakfast, go to work, talk to people, laugh, enjoy life. So we do not shy away from seeking help in the hospitals. Um, then, as well as medication, lifestyle change, we encourage exercises, good music, good diet, engaging in activities, social support, because those ones also tend to give us natural body um, happiness chemicals. They actually increase in our bodies, and you find you're happy and you're able to just enjoy life just like anybody else. Now, in situations where you find you do not treat depression, the risk of suicide is high. And suicide is a very worrying condition we do not take lightly. On average, WHO has estimated that we have 4 suicides in Kenya every day. That is rather high. And what is suicide? Suicide is the intention of causing death to oneself intentionally, yeah, causing death to oneself. And usually it's a result of untreated prolonged depression. So causing death to oneself is really the worst situation in mental health, and it's preventable. So when you see somebody has, it tends to be withdrawn, they start talking about death a lot, they start giving away their belongings, and you find they start behaving basically differently and withdrawing from society. Be concerned, because this is somebody who could be planning to commit suicide. Some will even leave notes, but there are those who will not leave any notes. So we have to be alert, change in behavior, change in character, being withdrawn, hinting about death, hinting that they're tired of living. Let's take that seriously. Because once we know that, then we have to really engage them. Do not leave them alone. We have to encourage that they get help, and it's actually a psychiatric emergency. Somebody who is suicidal, we admit, and we're able to see them. We try to find out the root cause. We're able to give them, again, life-saving medication and life-saving psychotherapy. And we really promote holistic care, which is not just medicine and counseling. There's spiritual therapy, there's occupational therapy, there's games, music support. But then we want to involve the family to look at what are the real causes, what are the underlying reasons why you're depressed, and why would you go to that length of wanting to kill yourself. And there's so many people's lives have been saved from treatment in our hospitals by our mental health specialists. And we urge each one of us, please, when we identify somebody with depression, with suicidal intention, seek help. We have our numbers, you're going to see them online. Please call us, and we'd love to help um, anybody in need. And we want to help them early as possible, so that it's not too late to be able to help them cope. Otherwise, thank you very much for this opportunity.